What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu, RSV, maybe a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, including COVID, I hope you have a full and speedy recovery with no long COVID issues and no long-term issues from those other viruses. It is time now for the Wednesday edition of the Virus Update for Wednesday, January 22nd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all things COVID and all those other viruses that can make us sick. Let's face it, there's a lot of viruses out there. The viruses are running high this winter. One virus is actually, in some states, not all states, is actually starting to go back up again. It didn't have a big rise at the holidays, and well, because of that, some states are actually seeing a rise once again. More on that in a little bit. And of course, just want to stay informed with the news and what's going on. Subscribe down below. Give this video a thumbs up. Let's try for 200 like button hits today. Yesterday I asked for 175. We had more than 200. And of course, we are trying for 10,000 subscribers by the end of this year. So far, we're rolling right along. And share this video with anyone you know, hit the notification bell, and leave your comments down below. Hey, the more subscribers we get, the more people I'm informing, and the more in the know everyone can be on what's going on with these viruses. Alright, we do have quite a few things today. We have several news stories. I have some news that's not listed in the news stories. We'll get to that a little bit later on when we get closer to the data portion. Matter of fact, we will do it within the news portion because some of the things that I have queued up today is data related. I have a major announcement about that. It's not a good one. Anywho, we're also going to take a look at some data, maybe some wastewater. We do have some numbers from CJS, and we do have New York State to take a look at today. Kind of a little concerning with New York State today. So let's start off with the news. First off, 2 measles cases confirmed in Snohomish County, Washington, after Seattle airport exposure. I hope I said that correctly. I have said it incorrect in the past. I hope I finally got it right. But, yeah, remember there was also the exposure up in Alaska and in between the Alaska and Seattle airport. So, yes, 2 cases now, and it says people who have had exposure would start seeing symptoms between January 17th and the 31st. We're only at January 22nd today, so several more days for symptoms to pop up, meaning there could be more cases that show up from this. This will make it to today's post. Any news story or thing you see in the news portion of this video will make it to today's post on the website. I'll probably get to that later on this evening, like tonight. Lately, I've been doing it in the overnight hours. That's probably when I'm going to get around to doing that. Egg shortages. Yes, we've talked about this before. Just confirming something that we already know about. Egg shortages, higher price spike as bird flu grows. Yes, to all those who thought, oh, the next 4 years the prices are going to start going down. Well, I got news for you. Bird flu is going to wreak havoc and continues to cause problems, and it's going to be no different than last year. In fact, the conditions with bird flu and the prices, it may actually get worse than what we have seen last year, and I am starting to notice increases in prices of eggs, and here in some places it's saying eggs are $6.95 to $7 for a dozen eggs. That is ridiculous, but with bird flu causing shortages, I mean, supply and demand, and the supply is not there right now, and the demand is there, so yes, we're having problems with bird flu. Alright, stomach bug causes surge in Arlington as experts warn of Norovirus. This is down in Virginia. A notoriously contagious stomach bug spread through Arlington has public health experts urging extra precautions, and yes, this is happening in schools as well. Norovirus is what is the problem down in Virginia, and norovirus outbreaks you can see on this chart. Weekly norovirus-like outbreaks, northern region of Virginia, I believe this is. And take a look here. It does continue to go up at this time and has been since about, we'll say, late November up until now. Hopefully we will see a peak in this area for norovirus relatively soon. Now moving on to this from David Christopher, and he works at a hospital in Northeast Ohio, so he does supply information of what's happening in his hospital. I do believe we have two things for him. Yes, there is a second thing as well. First off, he posted this on the 20th. I just noticed it today, so I figured, you know what, we need to add this. Back on the 20th, he said non-stop patients in his emergency department today and a 90% positivity rate on influenza A PCRs since yesterday. What worries him is the new CDC guidance only recommends subtyping in patients who are flu A positive to rule out a H5, and there are exponentially more outpatients who aren't being subtyped. So what this means is basically they're not doing enough. There's not enough sequencing to see, hey, is this just a regular flu or is it bird flu? We're not doing enough, and it's true. All over the country, we're not doing enough to check and see what's going on. And unfortunately, that's not about to get any better anytime soon. Now moving on to the other post from him, and this one is from today. He says, here in Northeast Ohio, SARS-CoV-2 and RSV infections have peaked and are starting to decline. That's good news. But there's still a lot of COVID and RSV out there, so be vigilant. Influenza A infections are skyrocketing, with positivity rates approaching 25%. His emergency department is being overrun by patients with flu A. And let's take a look at these charts. Yeah, you can see here, COVID's starting to drop. Influenza A, wow, look at that. It really is skyrocketing. That's not good. And RSV at this time, while dropping, is still relatively high for the moment. Moving on to this, which just popped up within the last few hours. Sting has abruptly canceled major appearances and postpones all shows due to illnesses. I believe it's 3 shows, but it could be more. But as of right now, he is postponing shows from January to, I believe, it sounds like it's going to be May and June. So this is going by doctor's orders. I do not know many details about the illness. If I knew more, I would be telling you more. But it sounds like right now he is just very sick at this time. And because of that, he has to cancel the shows, as you know, due to contract, insurance purposes, many different reasons. Oftentimes, they can't tell about the illness until after the illness has actually happened. I'll make sure this makes it into the archives on the website, which I'm sure there's going to be quite a few things I'm probably adding when I do my night owl session tonight, or when I add that stuff in overnight. Alrighty, this I have to share with you, and luckily I can share it with you today. After today, I don't know if I'll be able to share this with you anymore. Let's just go through this data first, then I shall explain. Seeing multiple states going back up again for COVID on the CDC ER visit page. Also seeing several states where the drop, I put dropped, it should say just drop, has essentially stalled. 2 factors could be at play. 1, the extreme cold, and 2, immunity from that summer wave is wearing off. Yep, it's possible. So let's just take a look at a few of these states. Look at South Carolina. He was dropping nicely. All of a sudden, South Carolina's gone back up again. Take a look at Idaho. Was dropping nicely. Suddenly, Idaho's going back up again. Take a look at Louisiana. Louisiana was dropping, then it stalled, and, well, it was really cold and snowy in Louisiana yesterday. We'll have to keep an eye on what happens there. What's my point? You see some people post on X or other places. They talk about the national trends, or they talk about a region. Okay, if the national trend's doing one thing, or a region's doing one thing, that does not dictate or tell you what is going on in your local community. Sometimes even just looking at a state level doesn't tell you what's going on in a local community. For example, I live in Pennsylvania. Maybe Western Pennsylvania is dropping and doing fine, or like it is. It is on the map right now. Well, maybe another portion of Pennsylvania, which you may live in, is rising. Well, guess what? If you're rising, pay no attention to Western Pennsylvania. Pay attention to what's happening in your local area. If you live in a state right now that's dropping, fine. And you hear about, oh, well, the national level's dropping. Well, guess what? The national level doesn't dictate what's happening in South Carolina right now. South Carolina emergency department visits have gone back up again, which means there's a little bit of a rebound going on. In other words, maybe a second peaking is happening in some states. And you know what? We could see a few more states pop up. I said last week, this is a wild card, just because of how cold it's going to be. And, of course, number 2, we're getting further away from that massive summer wave. Some immunity is starting to wane and slow off. And I'll show you New York State in just a little bit. You're going to see when I show you New York State that Yeah, New York State's not. The drop has stalled there as well. Already in the tennis world, it's the Australian Open still. Jannik Sinner, hope I said that correctly, is potentially, I say the words potentially because it's unconfirmed reports that his illness is pneumonia. And so we'll have to see what happens. And here's the crazy thing. He is set to have another match. It's set to still be a go while he's dealing with pneumonia. And you know, tennis is a really physical sport. So I just don't understand why these athletes push themselves like this. I mean, there's so many of them dealing with long COVID. There was actually an article out just a little while ago. I didn't include it today that there are potentially maybe signs. Well, someone who posted the article said, "Boy, this all sounds like long COVID." Yeah, it does. All these different people dealing with illnesses and pneumonia, obviously. Well, COVID can cause pneumonia, but obviously catching pneumonia is not, I mean, long COVID, but you get the point. There's so many of them that are now just constantly getting sick. You have to wonder, did their immune systems get impacted by COVID in any way, shape, or form? And then we move on to this. In the NHL, the Golden Knights forward, Brett Howden, is dealing with an illness, and he may not be traveling with the team for their upcoming road trip. If he's not traveling with the team, that means it's pretty serious and could be contagious. So now we're going to have to keep an eye on the Golden Knights to see if any other people get sick. As you know, in the basketball world, there have been just a load of illnesses. In fact, there's so many, I didn't even get to include them all on here. There are many that we actually missed because it's just gotten totally ridiculous what's going on with how many players are just out ill in the NBA. And, well, the NBA does have a participation policy, but I don't think that applies when there's a virus. But the problem is they're not telling us what these illnesses are. So, yeah, big problems there. All right, Brown University Health reinstates masking due to rising respiratory viruses and transmission rates. This was posted on my site by moderator Steve. This is a good thing that they are going to be reinstating masking. In Canada, the viral activity level of COVID-19 is moderate. Flu A is high. Flu B is moderate. And RSV is high at this time. Taking a look at what's going on with air qualities. Hey, some data that we're still going to have. We're still going to have a lot of data. I should pause for a second. We're still going to have a lot of our daily things that we look at. It's the CDC where we are going to have much less data. And I got news for you, folks. My reports are not stopping. Even if we have zero CDC data, these reports will continue. Though be it they may become a little shorter at some point if that happens. These reports will continue until, I don't know, it's banned that there can be news reports on viruses. Yeah, that's what's happening. We may take some breaks from reporting from time to time, but my reports are going absolutely nowhere at this time. All right, air qualities are bad in the West Coast, along the West Coast, and in the East. Again, I suspect that this would probably happen, and I think it is happening. Increased uses of fireplaces just because of how cold it is outside. Take a look at this. You can see from the southeast up into the northeast, the Great Lakes, even Texas and Oklahoma, there is increased fireplace use causing some bad air qualities. Look at Florida. Speaking of that, Pinellas County, Florida, we do see quite a few calls at this time. Sick person, unconscious person, so that's something we have to keep an eye on. Philadelphia for Tuesday reports 828 EMS incidents. That is over 800. So I always consider that to be really high or concerning when it's over 800. And you got to remember, this is a big city, so it is going to happen at times, but happens more frequently since COVID. Speaking of something that's not good or frequently happening, respiratory calls in Chester County, Pennsylvania. This is not the live look-in. This I tweeted earlier because it was a little concerning. There was not one, not two, not three, not four, but five, but 6 respiratory calls at once around 2:50 p.m. Let's see what's going on just outside of Philadelphia now, and take a look at Montgomery County, Pennsylvania. Wow, 19 total EMS incidents at the moment. We're seeing just a mix of different things. We're seeing a lot of falls and injuries, and, well, it is icy outside still. There are some people who haven't done their sidewalks. It's icy, cold, so, yeah, that could be a problem. Taking a look at what's going on with Chester County, and uh-oh. All right, yep, there's still a good number of our respiratory calls. 1, 2, 3, and even a sick person call mixed in, so not good to see that it has been constantly busy pretty much all afternoon long. Taking a look at what's going on with the hospital situation in Pennsylvania, and generally from south central Pennsylvania on east and northeastward, yeah, there's quite a few hospitals dealing with some yellow, which means those are hospitals that are dealing with high patient volumes. So, yeah, not a good thing. Taking a look at New Jersey, and hopefully we will see not too many hospitals dealing with problems, but so far, 1, 2, 3, 4, 5, 6 hospitals dealing with problems at this time, and Penn Medicine Princeton, yet again, is doing a full divert. They have been doing several diverts lately. That's just not a good thing. And if we looked at that hospital ER, if we looked at that ER page again for COVID, it does show New Jersey is kind of level. It's not dropping at this time. It was, but now it's just kind of leveled off. So that is not a good thing to see. New Jersey is still having a rough go at it with the viruses at this time. The national positivity rate from Walgreens is 12.3%, and at Walgreens there was 6,928 tests done this past week. And let's take a look at the positivity rate for flu at Walgreens, and take a look at that. It is still rising. 6.44%, 6,955 tests were done, and it looks like the worst state may be Idaho. That's coming up dark blue. 16.67% positivity rate with 12 tests. Already, I was going to show you some wastewater. Let's just do one wastewater site, shall we? Hollywood, Maryland at this time is coming in high for COVID. Maybe it's leveling off. RSV is high at this time. Influenza A is still rising, as it is in a lot of places. And we can see here Norovirus is still going up at this time. Hopefully, my hope is, with us losing some data, wastewater scam will not be one of the things that we lose. Now, mind you, they have much less wastewater sites than the CDC. There are some states such as Wyoming, Montana, North Dakota, that don't have any wastewater sites on here. I hope maybe they pick up the slack and just add some more wastewater sites. All right, taking a look at New York State for today, as promised, and we can see here total number of people who tested positive, 827. If you look, that is slightly higher. You can see it here. That is slightly higher than last week at this time. So that's concerning. And when we take a look at hospitalizations, we can see today's 925 hospitalized and 89 in the ICU. The hospital number itself, that 925, is one higher than any point of last week. So, yeah, the drop is essentially stalling. It's slowing down in New York State. And the big wild card is, will tomorrow go higher? If tomorrow's hospitalizations go higher tomorrow, that is somewhat of a red flag, signaling that maybe a second peak could set in. Remember, in much of east of the Mississippi, it is really cold right now. Some of the coldest air in years, and in the southeast, it's absolutely historical. But it's oh so cold. A lot of schools are canceling recess. People are being stuck inside. Not as many opportunities to go outside and get some fresh air. More chances for these viruses to circulate. All right, now some data from CJS 83172. In Florida, this is a daily number. These are COVID numbers. 648 new cases and 1 new death from, get this, 2023. New Jersey, weekday. Now, this is a lagged update. 1,099 new cases, 5 new deaths in a 4-day update. The extra day accounted for observing Martin Luther King Jr. holiday. New York, 948 new cases yesterday's report. Puerto Rico, daily, 153 new cases. Maine, weekly, 648 new cases and 5 new deaths. Their total COVID deaths are 3,563 reported by the state. Michigan, 4,560 new cases and 48 new deaths. Michigan's total deaths are 45,821. Virginia, 2,558 new positive tests and 11 deaths reported by the CDC. They have a total of 25,648, 25,684 total COVID deaths. Wisconsin, weekly number, this is delayed from Friday, 1,676 new positive tests, a test case positivity rate of 9.6%, and 20 new deaths reported by the CDC data tracker, and they do have a total of 18,431 total COVID deaths. Alrighty, quickly before I go, I gotta remind you, take your hydration break. Make sure you always stay hydrated. I'm staying hydrated with some juice here. Let's do that right now. Stop and take a hydration break. already. See how easy that is? Keep yourself hydrated because it is important, especially if you're sick. You do not want to come dehydrated. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. We will have another update again tomorrow. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know. The more people that get informed about what's going on here, the better. We need to keep more people informed. Of course, leave your comments down below and hit that notification bell. I will see you all again next time because guess what? These updates are not stopping. They'll be around as long as I am allowed to do updates on viruses. See you again next time. Stay safe, everyone. Have a fantastic Wednesday evening. Thanks for watching.